and it has increased costs just in Massachusetts of about $4 billion over when this program was started in 2006. And just today, the governor himself announces an extra $300 million hole in our healthcare line items. So it is bankrupting the state, and would have bankrupted our state if not for the federal government being overly generous with Medicaid reimbursements over these last 4 years. They've really propped this system up to keep it in place.
So what is the difference between this system and the Massachusetts system? I mean, if this is the pilot program, I've noticed that nobody has gone in and said, hey, maybe we should do a pilot program. You know what? In your beloved Illinois, Barack Obama, do the pilot program there, because if it works, great. But nobody wants to do that. If they say this is the pilot program and it's disintegrating, what has the government learned and has changed in this bill? Any idea?
I don't think anything's changed. I haven't read all 2,000 pages, but there's exchanges, which is not supposed to be a public option, but is functioning as if it was a public option in Massachusetts, because most of our people who have been covered with heavy subsidies or free health care. It's really serving as a second Medicaid program, this public exchange. So we have regular Medicaid that's costing us over $10 billion a year. And then you have this connector that is matching people up and giving them coverage of which they're not paying anything for.
Okay, tell me what this means to the life of people up in Massachusetts. Tell me exactly how, because everybody just thinks it's going to be sunshine and lollipops, and somehow or another, Oompa Loompas are going to create, medical care for people. Tell me what this means for the average person that's lived in Massachusetts now.
Higher insurance premiums.
They say that they're supposed to go down.
They've gone up higher in Massachusetts than I think any other state in the nation. So it has not created any competition, because you only have four major players, four major insurers. So you've got more people, complete access. It's a mandate. You pay a tax if you don't sign up.
Which is in this bill.
Which is in the bill.
I've been told over and over again that I have no solutions, and that's not my job to come up with public policy. But one of my solutions has been end the regulation over state lines. Let me buy insurance from any state that will offer it at a better deal. You only have four options in Massachusetts.
Yeah,
okay.
And we agree on that point. That should be something. I mean, if
Easy.
you create access, but not any competition, you're going to be paying higher prices.
Correct.
We're limiting access to community hospitals. We've got 7 community hospitals suing the state of Massachusetts
Why?
Because they're not being reimbursed at a high enough rate. They're getting all the poor patients, and the government is only reimbursing them 60 to 70 cents on the dollar. So they're suing because they're going bankrupt. Those hospitals that are outside of Boston, in the neighborhoods of Massachusetts, are suing the state since this plan has been in place, which is going to really limit access, not increase access. And costs have not gone down. I mean, costs are still among the highest in the nation. I mean, we're a high-cost state anyways, because we have these teaching hospitals at Harvard and Beth Israel.
Is everybody that you run into, are they just stupid? Or is there just another idea?
No, I think they've been convinced that this is working. And what we said on Tuesday of this week is it's not working. It's blowing a huge hole in the budget. I was challenged by our governor to say, where have you been on this issue? We've been fighting as treasurer. I've been trying to balance the budget for the past 2 years and wondering where all the money's going. And what we've discovered in the official statement that the governor and I signed, that all the money, increased money, is going to Medicaid and to this health care reform by over 52%. Increase over these last 4 years, over and above the rate of inflation. No other budget item in our budget has gone up even close to that.
Okay.
So that's where I say, be careful, country, because it's going to bankrupt us. I mean, without this federal reimbursement, we wouldn't have the money to pay for regular services in the state of Massachusetts today.
Hold on just a second, and Rick, I want to get to you, because you're kind of a common sense guy to me. But I have to go to Washington now, because we have two people that have been standing by, Michele Bachmann and Iowa Congressman Steve King, and you're both being called to the floor to vote. Vote on what exactly are you being called to vote on?
Well, a U.S. Coastal Waterways bill right now, Glenn.
Is this isn't the one where they're talking about limiting fishing and everything else, is it?
Don't know if this is it or not.
Okay, all right.
We have a CAPS amendment up. It's an environmentalist amendment, so we have to hustle over there and vote no against the environmental extremists.
Okay, all right. So tell me what you guys see happening this weekend.
Well, from my standpoint, this is now the last-ditch fight to end this effort to produce socialized medicine in America. The central event we're asking American people to join in is at noon tomorrow on the west side of the Capitol. It's time for everybody to come to this hill and pitch a last stand. It's like 4th and goal. We've got to hold them off. They know that the momentum shifts to us if we beat them here this weekend, and it's going to take everything we have in America to do so.
So let me ask you this. You know that I'm not kidding you, the socialists and the communists are also planning rallies there on the Mall this weekend. Workers of the World Unite. And then you also have a big rally, or what's being said is going to be a big rally, for immigration reform. You've got a powder keg happening in Washington. Are you aware of that? Is anybody nervous about bringing everybody together like this with the tension this high in America?
I imagine the Capitol Hill police are a little nervous about it. I have planned to be there at the illegal immigration rally on Sunday regardless, and now we have Nancy Pelosi that's actually called a vote on that same period of time. So this could be volatile, but I think the American people are peaceful in their heart, and as long as their votes are reflected, they will be peaceful, and I'm hopeful that this Congress will react to the will of the people.
The part that I'm worried about is, you have radicals in America that are, I mean, we've played this bald communist over and over again who wants revolution, who, they want civil unrest. It works to their advantage. I'm concerned about the anarchists that always are standing side by side with, the workers of the world, if you want to euphemistically call a communist that.
Well, Glenn, I've watched those people in the parades here in town, a human river of discontent pour down Pennsylvania Avenue. I don't know that we'll quite have that here on Sunday. It's more focused on illegal immigration, and it's been a little more peaceful than the anti-war rallies, for example. But we need the American patriots to fill this city on Saturday, to peak out at noon, and that's how they're going to get their message. If we can save America from socialized medicine, then we can deal with the rule of the law the next day.
All right, Michele, I want to ask you, because you and I have been talking back and forth for quite some time, and I think you and I think alike in many things. And the one thing that I'm concerned over is this idea that it has permeated America, that big government is always the answer, and it has gone to the people like Lindsey Graham, et cetera, et cetera. If this passes, I think it makes the election of people like Lindsey Graham, who are the compromise with big government, darn near impossible, because you can't tone this one down. You've got to pull this back by strong constitutionalists. If this passes, don't we lose really the Democratic Party to the socialists, and the Republican Party either has to be, real federalist, real people that understand controlled power, or you are going to have a third party? Do you understand what I'm saying?
I do. This is the greatest opportunity for the Republican Party to redeem themselves and regain their footing with the American people. But they have one chance, because the American people have this much patience left. They have had it with Republicans, they've had it with Democrats, and now with the rise of the Tea Party movement, the American people want to know, where can they go to have their voices heard? If the Republican Party is wise, they will embrace the Declaration of Independence and the Constitution of the United States and Bill of Rights and stand strong on those principles. I believe that they will this fall, and it's really up to the individual candidates to make their case to the people. The American people, like Steve King said, are not violent people. We don't want to see violence.
No.
But the American people are frustrated because they look at Nancy Pelosi on the Hill and they say, why aren't you listening to me? 3 out of 4 Americans don't want this bill, and there's good reason for it, Glenn. I just found out, for instance, the IRS will be the enforcer for this government takeover of health care. Every month, 16,500 new IRS agents will be hired at a cost of $10 billion. Every month, IRS agents will verify that 300 million Americans have purchased health care acceptable to government. They'll also be verifying that employers have insurance that's acceptable to government. And the IRS can now share confidential taxpayer information with the Department of Health and Human Services. And if the American people or employers don't comply with what the IRS wants, they have the power, Glenn, to levy fines of 2% of a person's income or over $2,000, whichever is greater.